Welcome back to Pregnancy in Your 30s. Pregnancy in your 30s is often a time of readiness and joy, but it is natural to wonder about the potential risks. I'd like to explore some common concerns and how proactive care can ensure a healthy pregnancy for you and for your baby. Most women in their 30s have healthy pregnancies and deliver healthy babies, but it is true that certain risks can increase slightly with age. By understanding these risks, you and your obstetrician can take proactive steps to manage them and ensure a safe journey. One of the risks often associated is chromosomal conditions, such as Down syndrome. Chromosomes carry genetic information that helps your baby develop. And as women age, the eggs they release are more likely to have small changes in their chromosomes, which can increase the chances of conditions like Down syndrome. For example, at age 30, the chance of having a baby with Down syndrome is about 1 in 1,000. By age 35, this rises to 1 in 350. And at age 40, it is closer to 1 in 100. While these numbers may seem concerning, it's important to remember that most pregnancies in women in their 30s result in healthy babies without any chromosomal abnormalities. Doctors now have excellent tests to assess the risks of chromosomal conditions during pregnancy. One of the common options that we rely on is non-invasive prenatal testing, or NIPT, which involves a simple blood sample from the mother, which detects an increased risk of certain conditions. For families seeking more detailed answers, diagnostic tests like amniocentesis, that is, taking fluid out of the amniotic sac and testing it for chromosomes, or chorionic villus sampling, that is CVS, can confirm chromosomal conditions. These tests carry a small risk of miscarriage, and if done in experienced hands, even that risk comes down. And your obstetrician will help you weigh the benefits and risks to make the decision that feels right for you. Let us also talk about the risk of miscarriage. A miscarriage is when a pregnancy ends on its own in the early stages, usually before 20 weeks. This often happens because the baby is not developing properly, frequently due to chromosomal changes. As women age, the risk of miscarriage increases. In your early 30s, around 15 to 20% of pregnancies may end in miscarriage. By age 35, this rises to about 20%. And by age 40, the risk can be as high as 40%. While experiencing a miscarriage can be emotional, it is important to know that many women go on to having healthy pregnancies afterwards. Your doctor can guide you on the best steps to take if this happens, and support is always available. Certain pregnancy-related conditions are also more common in your 30s. Gestational diabetes occurs when blood sugar levels become elevated in pregnancy, and it is more likely for women who are older, having a higher body weight, or have a family history of diabetes. This condition, which is high sugars in pregnancy, can affect the baby's growth, but is typically manageable with changes in your diet, exercise, and sometimes even medication. Preeclampsia is another condition to be aware of. It's a type of blood pressure that develops after 20 weeks of pregnancy, and symptoms include swelling, persistent headaches, and protein in the urine. If untreated, it can cause complications for both the mother and the baby. However, with regular monitoring of blood pressure and other symptoms and good care, most women with preeclampsia go on to have healthy pregnancies and deliveries. Although these risks are real, they are manageable. Advances in prenatal care, early screening for preeclampsia, gestational diabetes, etc., and personalized healthcare plans mean your doctor can help you navigate your pregnancy safely.